Cathaoirleach, I welcome the opportunity today to discuss long COVID health services, and I want to thank the deputies for tabling this private member's motion, and especially Deputy Naughton, who has raised this continuously here in the Dáil for, I would say, the past 12 months. And I think it's really important. We had, there was a PMB last night on home care, and I was delighted to attend and speak and here again to discuss long COVID. I think these debates are really, really important, and they have to be had, and I did welcome the chance that you put it down. Long COVID is a very challenging condition, both for those who experience it and for service planning and delivery. There has been progress in establishing a national service, and the Government is allocating additional resources in 2023 to ensure the full implementation of this service. The budget will facilitate an overall investment of an additional €6.6 million next year for the further development of long COVID services to ensure a full national service is in place. And I think that's the really important point. Again, we move away from the postcode lottery. We have a national service wherever you're living that you can, get that support. And there's probably not a family in Ireland or an extended family that haven't a person who feel they have symptoms of long COVID. They have symptoms that they didn't have prior to getting COVID. And I do know one person in my own extended family that has been dealing with multiple of issues for the past 12 months. So whereas previously we might have had some deputies who might have been leaning towards being COVID deniers, and now today they're in talking about long COVID, I do think it's very important that we all accept and realise that it's a very real thing. And I know it is a real thing, judging by the interaction I've had with people who've had long COVID. As knowledge develops internationally, and I think this is one of the things that we have to talk about, because, 2 years ago we didn't know, or 2.5 years ago we didn't know anything about COVID, 3 years ago, and now we have the effects of long COVID. And I do think it's really important that as the knowledge develops internationally, the HSE's interim model of care will be adapted to ensure it is in line with the most updated evidence. And that's really important. We have to adapt, we have to be flexible, we have to be nimble to make sure that we can support the best national approach to supporting those with long COVID. The HSE will continue to monitor demand for services and to model the numbers of people affected by long COVID based on national and international data. In this regard, an epidemiological survey is planned, which will provide insight into the prevalence of long COVID in the Irish population and risk factors for developing long COVID. This study will inform further service development. I am informed by the HSE that this study is currently in phase 1, which involves testing the design of the study and recruiting the personnel required. The HSE has also commissioned the Health Information and Quality Authority, HIQA, to conduct an international review to further inform the development of the service to ensure it is in line with international best practice. The review is expected to be completed later this month. HIQA have carried out many very useful evidence reviews over the duration of the COVID pandemic, many at the request of the National Public Health Emergency Team, which have been helped to provide an evidence base for various public health measures implemented over the past 2.5 years. As with all aspects of our national public health response to COVID-19, it is essential that the most updated evidence continues to be used. The HSE and the Department of Health continue to monitor international data and research to ensure all available evidence is used to improve service planning and delivery. The Department of Health, through its lead funding agency, the Health Research Board, currently supports a number of studies into long COVID. The Health Research Board will continue to promote long COVID as a critical area where evidence is required to inform clinical practice and policy development. Ireland, with the support of the Department of Health and the Health Research Board, continues to participate in international research studies on COVID-19, including the World Health Organisation's Solidarity Plus trial and the EU Solid Act. As you have heard, providing care for those experiencing long COVID requires a multidisciplinary response, particularly as symptoms and their impacts can be so variable. And that's something I have been struck with, how varied the different symptoms are for different people. General practice plays a key role in the delivery of a national long COVID service, with the initial role of general practitioners being to exclude acute or life-threatening complications and other unrelated diagnoses. As part of the implementation of the model of care, the HSE has engaged with the Irish College of General Practitioners and other professional bodies. Through this engagement, it has identified the opportunity to provide further education and training in relation to the management of long COVID, including when and how to refer patients to specialist services. The HSE is currently liaising with the Irish College of General Practitioners regarding how future training and education can be optimally designed and delivered. I also understand that the HSE are also engaging with patient groups, which I think is really important, such as Long COVID Ireland on service development. Fortunately, evidence to date continues to indicate that most children recover quickly from long COVID, and the incidence of long COVID is low in children and young adults. The best available evidence supports the provision of care to children by their GPs and, if necessary, by general paediatricians who work in multidisciplinary teams and have specialist terms to refer to, including paediatric, respiratory and neurology teams as needed. The National Clinical Programme for Paediatrics and the National Clinical Advisors and Group Leads for Children and Young People continue to work closely with the HSE Long COVID team to review evidence and support access to care. The motion being discussed here this morning speaks to the need to ensure services are in place for those with care needs as a result of long COVID. And I would like to assure my colleagues that addressing COVID-19 is something all government partners have prioritised in the programme for government. The strategic approach to the management of COVID-19 preparedness for autumn-winter 22-23, which was published last month, acknowledges the need to ensure provision of a national service for those suffering from post-acute COVID and long COVID. It also emphasises how the clinical understanding of this condition will continue to evolve through the review of expert guidance to reflect best practice and ensure an effective service with a health workforce suitably upskilled in the recognition and management of both post-acute COVID and long COVID. To date, 5 new post-acute COVID clinics have been established. These post-acute clinics are managing patients between 4 and 12 weeks after the initial onset of infection. Long COVID clinics are managing patients 12 weeks post-onset. 5 new long COVID clinics have also been established. Patients are referred by their GP to these clinics as needed, and more clinics are due to open in the near future in Cork, Letterkenny and Limerick. To care for those experiencing long COVID, clinical input is provided as needed, depending on symptoms, by a range of healthcare professionals, including those working in respiratory medicine, infectious diseases, neurology, mental health, allied health professionals, general practice and other community services. These interdisciplinary teams guide and support patients through all aspects of recovery, supporting care for a range of primary symptoms. This, coupled with the HSE planned service developments, will ensure that all necessary supports will be put in place. I would like to finish by reiterating that those affected by long COVID will continue to be cared for through our health services. The Government and the Minister has committed to continued investment in ensuring a national service is in place. This service is evolving as international and national evidence becomes available to help us better understand this illness and its consequences. It will continue to evolve as needed to ensure those in need of care due to long COVID that they can access the care. And I want to thank you again, Deputies, for raising this really, really important issue, and I was happy to come in here and speak to it. And I do believe, as you know, as the different statistics emerge, I do believe personally myself that we will be dealing with long COVID for a time to come. Thanks, Minister.